Let's talk about something many of us have heard of and maybe, feel a little anxious about mammograms. But it's also one of the most powerful tools we have in modern medicine. So today we're going to get a much clearer picture of what a mammogram actually is and why it is so, so important. Okay, let's just get this out of the way right now. Nobody's ever said a mammogram is a day at the spa, right? This cartoon pretty much nails that feeling. But the real reason we're talking about this, the whole point, is that simple phrase you see on the screen. It can save a life. And that's not an exaggeration. And here's why it's so critical. This number, 1 in 8, that's the approximate lifetime risk for a woman in the US to develop breast cancer. When you see a number like that, you realize that early detection isn't just a nice idea, it's an absolute game changer. So, here's the bottom line. When it comes to breast cancer, time is everything. Catching it early, really early, before it has a chance to grow or spread dramatically, and I mean dramatically, changes the outcome for the better. This one single idea is the entire mission behind mammography. So, here's our roadmap for this explainer. First, we'll dive into why this matters so much. Then we'll walk through the procedures so you know exactly what to expect. We'll even peek under the hood at the technology, figure out how to decode your results, and wrap up with a really important note for men. All right, section 1, let's tackle the biggest question first. Why do mammograms matter? Well, it all comes down to the life-saving power of being able to see what our hands just can't feel yet.
Okay, so what is it really? At its heart, a mammogram is just a specialized type of X-ray. That fancy term, radiographic modality, just means it's a way of taking a picture using radiation. Its specific job is to hunt for any abnormalities or pathologies long before they can cause bigger problems.
And this, right here, is the magic of it. I want you to really let this sink in. 2 to 3 years. A mammogram can find a potential cancer 2 to 3 years before a lump could ever be felt by you or your doctor. That's an incredible head start. It gives you the most valuable thing in the world: time and options. All right, now let's pull back the curtain on the process itself. Knowing exactly what's going to happen can make the whole thing a lot less stressful. So let's walk through it. First thing to know is that there are 2 main kinds. Think of a screening mammogram as your routine checkup. You don't have any symptoms, you're just being proactive. A diagnostic mammogram, though, is what happens when there's a specific concern, maybe a lump or some other symptom. It's more like calling in a specialist for a closer look. Now, getting ready for your appointment is super simple, but there's one thing here that is absolutely crucial. On the day of your exam, no deodorant, powders, or lotions. And here's why. A lot of those products have tiny metallic particles in them that can show up on the X-ray as little white specks, which can look a lot like early signs of cancer. So skipping it just prevents a false alarm. Okay, let's talk about the part that can seem a little intimidating, the machine itself. We're going to take a look inside and understand what's actually going on. So here it is. It might look a little complex, but really, it's just a highly specialized tool built to do one job perfectly. You've got the X-ray tube up top creating the image, the detector at the bottom capturing it, and right in the middle, that's the compression pedal, which, yes, we are definitely going to talk about next. So you might wonder, why can't I just get a regular chest X-ray? Well, it's because it's the wrong tool for the job. Regular X-rays are great for looking at dense things like bone, but breast tissue is soft tissue. A mammogram uses a much lower, finely tuned dose of radiation that's designed to see all the subtle differences in soft tissue that a regular X-ray would completely miss. And that leads us to the number one question everyone asks, and probably the least popular part of the whole experience. Why on earth is that compression necessary? This illustration shows it pretty well, but here's a simple way to think about it. Imagine your breast tissue is a crumpled up newspaper. If you try to read it while it's all bunched up, you can't make out the words. But if you carefully smooth it out flat, suddenly every letter is crystal clear. Compression is doing exactly that. It's spreading everything out so nothing can hide.
Yeah, it's uncomfortable, but it's actually a pretty brilliant solution that does 3 critical things. 1, it creates a uniform thickness, so the picture is clear all the way through. 2, it reduces something called scatter radiation, which makes the image much sharper. And 3, it just holds everything perfectly still to prevent any blurring. It's not for nothing. It's all for accuracy.
And this is the whole point. This is the goal. A crisp, incredibly detailed image where a trained radiologist can spot any tiny area of concern. All that technology, all of that technique, even that uncomfortable compression, it all leads to this moment: the ability to get an accurate diagnosis. So you've had the procedure, the radiologist has reviewed the images. What's next? Well, now we have to understand the report. And we're going to do that by cracking the code on something called the BI-RADS score. So you get your report, and there's a number on it, somewhere from 0 to 6. And it can look like some kind of secret code, but I promise it's not. It's actually a really clear, standardized system so that doctors everywhere are speaking the same language. So what do these numbers actually mean? Okay, let's start with the basics. If you get a 0, it doesn't mean something bad is happening. It just means the radiologist needs more pictures to get a complete look. Now, categories 1 and 2? That's fantastic news. 1 means everything is completely normal, and 2 means they saw something, but it's definitely benign or non-cancerous, like a simple cyst. Okay, now for the categories that mean we need to pay a bit more attention. A 3 is for a finding that's probably fine, but they'll want to check it again in about 6 months just to be sure. A 4 means there's something suspicious, and a biopsy might be the next step to get a real answer. 5 means it's highly suspicious, and a 6 is just used for follow-up after a cancer has already been confirmed with a biopsy. And finally, we need to talk about something that's often overlooked, because while breast cancer is way more common in women, it is not just a women's issue. Breast health is a human issue. It's rare, for sure, but men can and do get breast cancer. In the US, about 1,300 men are diagnosed every year, usually when they're over 60. The symptoms are things everyone should be aware of, like any changes to the nipple. But here's the most important part. With awareness and treatment, the 5-year survival rate is an incredibly high 97%. And that brings us to the end. We've looked at why mammograms are so important, what actually happens during one, and how to make sense of the results. So now there's really only one question left to think about. What is your next proactive step for your own health? Whether it's scheduling your own screening or just sharing this info with someone you care about, taking that step is the most powerful thing you can do.